Kia ora, my name is Dinah. I am a community-based clinical pharmacist. Our improvement journey at the community pharmacy has been about providing proactive medicines management services to deliver good quality, innovative, patient-centered care to our patients. So it's putting the patient at the center of the model. Our critical success factors has been primarily integration with our GP team, them embracing us and we embracing them. It's also been pharmacists and technicians walking at the top of their game, so each of us recognizing and appreciating each other's unique skill sets. It's also been about redesigning our model of care and workflow to increase efficiencies, and at the same time adapting key pieces of technology, including robotic dispensing, the GP patient management system, and one of my favourites is the Whanautahi shared care tool. Whanautahi shared care tool has allowed us to basically help manage our medicines management services. So all our long-term conditions patients have been transferred onto Whanautahi. Most of the times their health is not the priority for the patients. There's other things that you're looking at, such as getting food on the table or just looking after sick family members. So their health usually comes quite below in their priority list. So it's quite important to take that into the picture when you're walking with the patient. So those assessments on Whanautahi helps bring those conversations out with the patient. We've been able to get our technicians to use Whanautahi and to help us manage LTC patients. So by getting technicians on board and them handling most of the administrative tasks, we, the pharmacists, myself, Robbie and the other pharmacists in the team, have been able to spend more time talking to the patient instead of doing all the paperwork.
I love it when people like Phyllis come in and she's just like so confident that we can help her. And she just like walks in and just kind of says what she wants and sits down in her little spot in the pharmacy. She's very comfortable, and we can just help her with everything, like her INR and her blood pressure and medicine changes. Like we can just pop next door and talk to the doctors if we need to, and it's just all like a really easy process.
I've told the world, and I do talk a lot, that it's the best chemist in New Zealand probably. Because if every chemist gave this sort of service, it'd be so much easier.
We provide an enhanced medication management service called Medicines User Review. And in Auckland, it's all paper-based at the moment. And what I've done is I've basically taken my Whanautahi and used that to do all my MUR assessments and all the paperwork on there. Because I've been doing it on an electronic platform, it's saved me quite a bit of time. We went to the Pharmacy Awards on the 22nd of July at the Pullman's Hotel. It was a beautiful, beautiful night. My team, Robbie and myself, we got a few awards, as you can see in the background. We got Community Pharmacy of the Year, we got Innovations in Delivering People-Centered Care and Advice, we got Professional Service of the Year for my gut project, and unbelievably, I ended up getting the Supreme Award. Being able to share what we've done with everyone else, it's a really nice and humbling feeling.
Having Whanautahi as a resource to actually allow those communications to capture all the interventions we do in a meaningful way, being able to share them or have them shareable, and it's saved us an enormous amount of time. Our journey with the patients is much easier, and if we have an easier path, the customers have an easier path, and the GPs have an easier path. So everyone's a winner, financially, workload, growth. Being able to actually get the staff to be able to enjoy their job, to be involved more. And the whole team sees the patient, not just one pharmacist or one staff member. We take it as a collective support we give the patient, so it doesn't matter who's there. They know they're going to get exactly the same level of service each time. We have wonderful solutions, IT solutions already there, like the Whanautahi one, and it's just about embracing what we have and making it doable. And we've done nothing extraordinary apart from actually put it all together. Work together as collective clinicians around the patient at the centre of the model, which is the whānau concept.
I've been with you since you opened the pharmacy, and during that time we've had nothing but pleasant, compassionate and reliable assistance with our health problems. Your setup now with the doctors is such that it makes it very easy and very quick to get health services. We have only to ring you and everything can be organised. But prior to that, we'd have to go to the doctor, make the appointment, see the doctor, come back to you and wait for the services. But now it's all done in one go. That not only saves us time, but a lot of money. It's very difficult to say much else except that the service is the greatest you can get. It's so quick to go and have the little prick and be told immediately what your INR is and have your medication adjusted. There's a big difference between having a little prick in your finger and going to the doctor to have blood tests taken, especially when I have no veins and they can never find them. So the prick in the finger works out well.